not sure anybody who's making these decisions has ever been there.
Earlier tonight, you heard from this Valley mother who lost her son when he turned from pain pills to heroin. She says the state's new Opioid Epidemic Act is doing nothing to stop a generation of prescription medical users from becoming heroin addicts. All month long, Arizona's family taking on the opioid crisis.
And new at 10 o'clock tonight, Nicole Crites got the governor to respond to the criticism.
Families fighting addiction right now say there's a lot in this plan that just doesn't make sense. It requires hospitals to refer patients who OD to rehab, where we are already seeing a serious shortage. We tried to get a sit down with the governor for weeks, but wound up having to track him down outside an unrelated news conference. What do you say to the families that are already being put on wait lists and turned away because there aren't enough beds for rehab right now?
We just signed the Opioid Act 10 days ago. We think it's the most aggressive, thorough, thoughtful legislation that's been introduced in years and years.
To get an addict to agree to go into a rehab facility, that's like climbing Mount Everest. But once you get them there, once they say yes in any capacity, timing is paramount.
Shannon Nitsch says this legislation offers no real solution to save the addicts one high away from becoming another one of our more than 3 overdoses a day. Her son Scott was one of them.
I couldn't save him. That's very hard to deal with.
Governor Ducey says this new legislation is a start, not the end, in the fight against opioids. His plan puts a strong focus on prevention with a 5-day limit on first-time fills, red warning caps on opioid prescriptions, training for responsible dosing, and more oversight at pharmacies and pain clinics.
What are you going to do with the fact that you have people dying right now?
Ducey's team says there is still plenty in the fine print for families in crisis to get help now. More Narcan to reverse ODs, immunity to anyone reporting an overdose, help to keep kids out of the foster system during rehab, and $10 million for treatment.
It doesn't even scratch the surface of where we're really at.
Shannon says that money's going to dry up real fast. 80% of opioid addicts relapse in the first year and need multiple rounds of treatment for sobriety. Her son's first stint in rehab cost $22 grand. She wants to see a plan to safely wean or taper patients who are already dependent on opioids without simply pushing them to the needle, then the grave. It's too late for her son, but not for other families.
That's what I want the decision makers to hear loud and clear. We have millions of people sitting there going, what now?
As we get feedback, as we have input, as we find ways we can do things better, we'll figure it out. I mean, this is why we have a legislative session. This is why you call a special session.
Last year, the governor ordered real-time tracking for overdoses, and now he has tasked the Department of Health Services to take a look at treatment facilities, how many beds, how often at capacity, and provide quarterly reports to give state leaders a better grasp on gaps in treatment, the next big obstacle in the opioid crisis.